Bismillahirrahmanirrahim. We are discussing the regulation of posture. And in this topic, we are discussing the postural reflexes. Postural reflexes. We discussed last time about the positive sporting reaction, negative sporting reaction, and then stretch reflex or myotatic reflex. The next postural reflex is tonic labyrinthine reflex. Tonic labyrinthine reflex. To study tonic labyrinthine reflex, we must abolish tonic neck reflex. Right? So in order to study the tonic labyrinthine reflex, we must abolish tonic neck reflex. How can we abolish this reflex? In animals, by cutting upper 3 cervical nerves. In animals, by cutting upper 3 cervical nerves. Or by immobilizing neck with a plaster jacket. So with a plaster jacket, we immobilize the neck. And then we study the tonic labyrinthine reflex. Now in this reflex, the stimulus is gravity. Stimulus is gravity. And receptors are the macula in the utricle. Macula in the utricle. And with nerve carrying impulses, vestibular nerve. So vestibular nerve carrying impulses to the center, which is in the medulla of the neuter. Center is in the medulla of the neuter. Tonic labyrinthine reflex is that the animal is standing on his forelimbs. Animal is standing on his forelimbs. When head is extended. Head is extended or dorsiflexed. Head is extended or dorsiflexed. There is increased tone in the extensors of all the four limbs. So increased muscle tone in the extensors of all the four limbs occur when there is dorsiflexion or extension of the head. When head is flexed towards sternum, then the tone in the extensors of limbs decreases. So head is flexed towards sternum, tone in the extensors in the legs decreases. So this is the tonic labyrinthine reflex. If we cut the vestibular nerve, this reflex is abolished. We cut the vestibular nerve, this reflex is abolished. Next is tonic neck reflex. Tonic neck reflex. Tonic neck reflex. To study tonic neck reflex, we must abolish tonic labyrinthine reflex. So to study tonic neck reflex, we must abolish tonic labyrinthine reflex. How can we abolish this? By performing labyrinthectomy. By performing labyrinthectomy in animal, we can abolish the tonic labyrinthine reflex. So we perform labyrinthectomy, we remove labyrinth in the animal to study tonic neck reflex. With tonic neck reflex, when neck is extended, neck is extended, there is increased muscle tone in the extensors, or you say the forelimbs are extended. Forelimbs are extended. Right? So neck is extended, forelimbs become extended, while the hind limb, H-I-N-D, hind limbs become flexed. You see? Neck is extended, forelimbs become extended, and what about hind limbs? There is flexion of the hind limbs. When neck is flexed towards sternum, the neck is flexed towards sternum, forelimbs become flexed. So flexion of the forelimbs, while the hind limbs become extended. Right? I again repeat that the tonic neck reflex is that when neck is extended away from sternum, the forelimbs become extended and the hind limbs become flexed. When neck is flexed towards sternum, forelimbs become flexed and hind limbs become extended. So you just keep in mind that these positions are adopted by the animal. Say, some prey, meat is lying on the shelf. Meat is lying on the shelf, and this cat wants to pick the meat on the shelf. So neck becomes extended, so forelimbs become extended, hind limbs become flexed. When the cat, the animal, wants to pick the prey or the meat over the shelf. Now in this figure, the prey or meat is under the shelf. Under the shelf, and the cat has to flex the neck. Towards sternum. So when neck is flexed towards sternum, forelimbs are flexed and hind limbs become extended. So these are the positions or postures to when the cat wants to pick the prey or meat from over the shelf and then under the shelf. When head is rotated to one side, on that side, limbs become extended. So when head is rotated towards one side, on that side, limbs become extended, while on the opposite side, there is some flexion of the limbs. On the opposite side, there is some flexion of limb. So this is the typical posture adopted by a boxer. Typical posture adopted by a boxer, like this. So my head is rotated towards the right side. So on the right side, limbs are extended. While on the left side, limbs become flexed. This is typical pose of posture of boxer, that my head is rotated towards right side. On the right side, the arm become extended, leg become extended, while on the left side, in the limbs, there will be flexion. So typical pose of a boxer. In tonic neck reflex, receptors are Pacinian corpuscles. the sinian corpuscles in the ligaments of cervical joints, the sinian corpuscles in the ligaments of cervical joints, and muscle spindles in the neck muscles, and muscle spindles in the neck muscles. These are the receptors. While the center of this reflex is located in the upper cervical segments of spinal cord and medulla oblongata. Center is in the upper cervical segment of spinal cord and medulla oblongata. So this was about the tonic neck reflex. The next are a series of reflexes which are called writing reflexes. Writing reflexes. Say an animal like cat is lying on its side or on its back. A cat is lying on its side or back. The cat assumes upright posture. The cat assumes an upright posture. First the head becomes upright, righted, then the thorax, and then the other parts become upright or righted. Remember, this cat lying on its back or side becomes upright. There is a series of writing reflexes, right? A series of writing reflexes which make the cat or the animal in upright position. First of these writing reflexes is labyrinthine on neck writing reflex. Labyrinthine on neck writing reflex. It means impulses arise from receptors in the labyrinthine which go to center of the reflex, and then there is writing of the head position, head becomes upright. So labyrinthine on neck writing reflex. Now when the cat or the animal is on its side, lying on the ground, on its side, the macula in the saccule, becomes stimulated. Due to gravity, the macula becomes stimulated. Impulses from the macula go to the center of the reflex, and from the center impulses come to the neck to make the head upright. So from the center of the reflex, impulses come to the neck to make the head upright. So this is the labyrinthine on neck writing reflex. The next writing reflex is body on head. Body on head writing reflex. Body on head writing reflex. It means impulses arise from receptors in the side of the body, in contact with the ground. Impulses arise from the receptors present on the side of the body, in contact with the ground, and these impulses of these receptors go to the center of the reflex, and from the center impulses come to the neck to make the head upright. So impulses arise from the side of the body in contact with the ground, and these go to the center of the reflex, and head becomes upright. the animal is lying on its side and on the ground. So one side of the body is in contact with the ground. One side of the body is in contact with the ground. On that side, there are exteroceptors stimulated. So exteroceptors present on the side of the body in contact with the ground are stimulated. Impulses from these exteroceptors go to the center of the reflex, and from the center impulses come to neck muscles to make the head upright. So this is the body on head writing reflex. Next reflex is neck on body writing reflex. Neck on body writing reflex. It means impulses arise from the receptors in the neck. Impulses arise from the receptors in the neck, and these make the body upright. So impulses arise from the receptors in the neck, and these make the body upright. Now in the animal, because of the two writing reflexes we have discussed, head becomes upright. Head becomes upright because of the first two writing reflexes. What about the body? Body is still in the lateral position. Head becomes upright, but the body is still in the lateral position. So there is twisting of the neck. Head becomes upright, body still in the lateral position, there is twisting of the neck. And because of the twisting of the neck, muscle spindles in the neck muscles are stimulated. Muscle spindles in the neck muscles are stimulated. Impulses go to center of the reflex, and then impulses come back to the body to make the body upright. To make the body upright. This is the neck on body writing reflex. Next writing reflex is body on body writing reflex. Body on body writing reflex. Impulses arise from the side of the body in contact with the ground. Impulses arise from the side of the body in contact with the ground, and these impulses go to center of the reflex to make the body upright. It means that body can be righted even if head is not righted. Body can be righted even if head is not righted. So body can be made righted even if head is not righted. So one side of the body is in contact with the ground. On that side of the body, exteroceptors are stimulated. Impulses from these exteroceptors go to the center of the reflex, which results into the righting of the body. So body becomes upright because of impulses arising from the side of the body in contact with the ground. Now these four writing reflexes which are discussed, labyrinthine on head, body on head, neck on body, and body on body writing reflexes, their center is present above the mid-collicular level. So their center is present above the mid-collicular level. So in decerebrate animal, in decerebrate rigidity, these writing reflexes are not present. So in decerebrate animal, in their decerebrate rigidity, these writing reflexes are not present because their center is above the mid-clavicular level. The next writing reflex is optical writing reflex. Optical writing reflex. Head can be made upright. Head can be made upright with the help of the visual impulses. Head can be made upright with the help of the visual impulses. Impulses arise from the visual cortex, area 17, and these impulses go to the neck muscle to make the head upright. So head can be righted, head can be made upright with the help of visual impulses. Right? And keep in mind, optical writing reflex is most important writing reflex in human beings. Optical writing reflex is most important in human beings to write the head, to make the head upright. Optical writing reflex is most important. And center of this reflex is in the visual cortex. Center is in the visual cortex. So this was about the writing reflexes. Next posture reflex is hopping reaction. Hopping reaction. Hopping reaction is that the animal is standing. Animal is standing. And you push the animal from the side. You push the animal from its side. The animal makes hopping movement to maintain the upright position. So animal is standing and we push the animal from the side. The animal makes hopping movement to maintain the erect position. In hopping reaction, receptors are the muscle spindles in the muscles of the limbs. So receptors are the muscle spindles in the muscles of the limbs. And the center is in the cerebral cortex. So center of the hopping reaction is in the cerebral cortex. Our next posterior reflex is tracing reaction. Tracing reaction. Tracing reaction. Say an animal, cat, falls from height, jumps from height. When the cat or the animal lands on the ground, the animal keeps his or her feet on the ground and will maintain erect posture. So animal jumps or falls from the ground, the cat, and the animal places its feet on the ground and then make herself upright. This is the placing reaction. Placing reaction. Which receptors are involved? Receptors involved are proprioceptors, visual receptors, and exteroceptors. So proprioceptors, exteroceptors, and visual receptors. Center for the placing reaction is present in the cerebral cortex. So center is in the cerebral cortex. So this was about the postural reflexes, and regulation of the posture. Next, I start discussion on speech mechanism. Speech mechanism. Speech mechanism. What is speech? Speech is a way of communication. Speech is a way of communication by which thoughts are understood and expressed. So speech is a way of communication by which thoughts are understood and expressed. Generally, speech refers to spoken speech or verbal speech. When you say speech, it means the spoken speech or the verbal speech. But speech also includes other ways of communication. Speech also includes the other ways of communication, such as writing, gestures, ishara, signs, and even music is considered to be a way of communication. So writing, gestures, signs and symbols, right? And music is also considered as speech. In the blind people, the braille system is also a way of communication. In the blind people, the braille system is also the way of communication. In a child, the first stage of development of speech is association of heard sounds with the visual and tactile sensations. So first stage in the speech development in a child is association of heard sounds with visual and tactile sensations. These impressions, associations, these impressions or associations are stored in the child memory. These associations or impressions are stored in the child memory and later utilized to speak out. I told you association of the heard sounds with the visual and tactile sensations. You know, if a child is born deaf, he will also be dumb, right? So because normally there is association between the heard sound and the visual and tactile sensation. Verbal speech, spoken speech, to discuss its mechanism. Spoken speech mechanism involves three processes, phonation, articulation, and resonance. So verbal speech mechanism involves three processes: phonation, articulation, and resonance. phonation is production of sound or voice. Phonation is production of sound or voice that occurs in the larynx, the voice box. So production of sound or voice that occurs in the larynx or voice box. Vibration of vocal cords produces sound. So vibrations of vocal cords produces sound. Now for phonation, vocal cords must be adapted. For phonation, vocal cord must be adapted. Must be adapted. Must be in contact with each other. You see, this is phonation, and vocal cords are adapted in contact with each other. When we want to phonate through recurrent laryngeal nerve, impulses go to the adductors of the vocal cords, and vocal cords become adducted. Now when vocal cords are adducted, as vocal process is heavier than the vocal cords, a slight gap remains between the vocal cords. A slight gap remains between the vocal cords. Expired air comes out with a high velocity of pressure. Expired air comes out with a high velocity of pressure, and this separates the vocal cords. It separates the vocal cords. But when expired air comes out with a high velocity, according to Bernoulli principle, there is a drop of pressure in between vocal cords. When expired air comes out in between the vocal cords at a high velocity, according to the Bernoulli principle, there is drop of pressure at this point. So again vocal cords comes in contact. Then again expired air comes out with a high pressure to separate the vocal cords. In this way, vocal cords are set into vibration. In this way, vocal cords are set into vibration. So I told you Bernoulli principle. Bernoulli principle is that whenever something moves with a high velocity, there is a drop of pressure. I give you a simple example. You are standing on the platform of the rail track. You are standing on the platform along the rail track. The train comes with a high velocity and passes away. But just after the train has passed, if you are standing on the track, you will be pulled towards the rail track. You will be pulled towards the rail track. Why? Because of drop of pressure there. So this Bernoulli principle is also working in the vocal cords adduction. Right? So vocal cords are set into vibration to produce the voice or sound. You know, sound has got three properties. Pitch, which depends upon the frequency of sound. Pitch, that depends upon the frequency of sound. Loudness, that depends upon the force of expired air. And amplitude of vibration of the vocal cord. It depends upon the force of the expired air and the amplitude of vibration of the vocal cord. And then third property of sound is resonance. Resonance. Now, pitch of the sound. It depends upon the frequency of sound. It depends upon the length of the vocal cord, length of vocal cords, tension in the vocal cord, tension in the vocal cords, and also the thickness of edges of the vocal cord. Also, the thickness of edges of the vocal cord. You know, male voice is low pitched. Male voice is low pitched, having low frequency. Why low frequency? Because in males, vocal cords are longer, their edges are thicker. In males, vocal cords are longer, their edges are thicker. So when these vibrate with a low frequency. So male voice is low pitched. Female voice is high pitched. Female voice is high pitched, having high pitch, high frequency. Because in the females, the vocal cords are short and their edges are thin. In females, the vocal cords are short, their edges are thin. So female voice is high pitched, having high frequency. I told you that loudness of voice depends upon the force of expired air and the amplitude of vibration of the vocal cords. Now when we expire the air with force, with high pressure, greater will be the amplitude of vibration of the vocal cord. Greater will be the amplitude of vibration of the vocal cord. Greater will be the loudness. So we can say, greater the force of expired air, greater the force of expired air, greater will be the amplitude of vibration of the vocal cords. So louder will be the sound. So greater the force of the expired air, more will be the amplitude of vibration of the vocal cords. So louder will be the sound produced. Right? So this was about the phonation or production of sound of voice in the larynx, the voice body. The second process involved in the speech, verbal speech, is articulation. Articulation. Articulation is formation of words. Formation of words from sound. Formation of words from sound produced in the larynx. So words are formed from the sound produced in the larynx. And what are the organs of articulation? What are the organs of articulation? Lips, tongue, and soft palate. So lips, tongue, and soft palate, these are the organs involved in the articulation. What is articulation? Formation of words from the voice sound produced in the larynx. Teeth also help in articulation. Teeth also helps in articulation. Certain speech consonants certain speech consonants are associated with certain structures. So certain speech consonants are associated with certain speech structures, certain anatomical structures. So certain speech consonants are associated with certain anatomical structures. For example, P and B are labial B are labial. When we want to speak P and B, so which part will move or contract? Lips. So P and B are labial. P and B are labial. Lips move predominantly when we want to speak P and B. D and T. D and T are dental. D and T are dental. When we want to speak D and T, top of the tongue is approximated on the back of teeth. So D and T are dental. Top of the tongue is approximately on the back of the teeth. So D and T are dental. N is nasal. So when we want to pronounce N, the nose is involved in this N or nasal. Now when there is a common cold, there is some nasal obstruction, so you can't pronounce correctly N. Now when you learn Kirat, when you part Kirat, the teacher tells you कि नून नाक से, नून की आवाज नाक से. So N is nasal. N is nasal. So this was about the articulation, and the third process in the speech mechanism is resonance. Resonance refers to the quality of sound. It refers to quality of sound, timbre, T-I-M-B-E, timbre of the sound. It depends upon the overtones. It depends upon the overtones. Resonance is provided by cavities or chambers. Cavities or chambers. Say nasal cavity, paranasal sinuses, pharynx, mouth, and even the chest cavity. So these are the chambers or cavities which provide resonance to the sound. And these include the nasal cavity, paranasal sinuses, pharynx, mouth cavity, and even the chest cavity. When there is nasal obstruction, there is change in the quality of sound, and it is called nasal twang. When there is nasal obstruction, there is change in the quality of sound, it is called nasal twang. So this was about the verbal speech, spoken speech mechanism involving the phonation, articulation, and resonance. In phonation, voice or sound is produced in the larynx, and then this sound is converted into words in articulation. And organs of articulation are lips, tongue, and soft palate. And then resonance is provided by the cavities or chambers. You have seen the musical instruments, guitar, and that into instrument there is a hollow space, and this hollow space is to provide resonance to the sound. So the hollow spaces are to provide resonance to the sound. Thank you.